Welcome family. In today's knowledge, let's talk about why you need a pregnancy ultrasound. There are many reasons for having a pregnancy ultrasound, but some of the most common are to diagnose a viable pregnancy, to assess the gestational age of the baby, to check the baby's growth and development, to check how many babies are present in the mother's uterus, to see where the placenta is positioned, to do a nuchal fold measurement at the back of the baby's neck and to assess if there is an increased risk of the baby having Down syndrome. This specific measurement needs to be conducted between 11 to 14 weeks. To assess for specific problems the baby may have, such as spina bifida. To assess the baby's gender, though this is not a primary reason for pregnancy ultrasound, it is often determined at the 20-week screening scan. To assess the cause of pregnancy complications. This may be bleeding, a decrease in the baby's movements, or if the mother has been experiencing pain. To detect whether there is an ectopic pregnancy. This is when the baby is growing outside of the mother's uterus, most commonly in one of the fallopian tubes. When an amniocentesis or chorion villus sampling test is being conducted, a pregnancy ultrasound is done at the same time. This is to ensure that the needle is inserted into the correct area and there is no risk to the baby. To check for uterine fibroids or ovarian cysts. Want to know more? Stay connected for my next video. Please watch my playlist, subscribe, like and share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.